The numbers are staggering. It's the leading cause of hospitalization for people over 65 years old. We currently treat 6 million people, and 500,000 new cases are diagnosed every year with various conditions of heart failure.
So you hold this against your chest maybe 15 seconds a day. So it's a brief assessment. And then basically the data is being uploaded to the smartphone. There will be a very good smartphone application backed up with artificial intelligence that gives the patient a lot of information.
Educating a patient about their condition so that they understand what's happening to them is a critical part of this whole thing. And so when it comes to self-management, a tool like this in the hands of a patient who's been educated can be something that will prevent hospitalization.
My name is Jim Connor. Welcome to Game Changers Silicon Valley. This segment of tonight's show will address the nature of heart failure. My guests are Dr. Ed Kirsch, a practicing cardiologist, and Steve Stevenson, CEO of Lifewave Biomed, a company providing healthcare monitoring between patients, doctors, and hospitals. Steve and Dr. Kirsch, welcome to the show. Dr. Kirsch, let me start with you by giving us maybe an explanation of this whole area of heart failure and all the variations on it.
Well, heart failure is the inability of the heart to either pump blood or for the heart to relax and fill with blood. In both of those situations, the usual thing is that the patient develops fatigue and shortness of breath. Eventually, it will go on to where you get edema, which is swelling of the lower extremities. Heart failure, I hate to say it, it's usually not curable, but it is treatable. And the prognosis is not very good. The prognosis for heart failure is about 25% of people, once they've been hospitalized for heart failure, will live about 5 years. Now, that's worse than most forms of cancer. Yeah. And it's a difficult problem. However, the quality of life and the length of your life can be improved with treatment, and that's the good news.
So I did a lot of reading in the past day or two and this morning, and I was amazed how extensive this is and all the things and technologies we've developed. But I want to go way back to people maybe like me who are not having any symptoms. How would I know that maybe I have some conditions that might later on lead to this?
That's a really excellent question, because the American Heart Association and the American College of Cardiology have created a staging system for heart failure, and it goes A, B, C, D. Stage A are people who are at risk for developing heart failure, and that means people with high blood pressure, diabetes, perhaps a high cholesterol, too much alcohol, things that could eventually lead to heart disease. That's stage A. Stage B are people who already have some structural heart disease. Maybe they have a leaky heart valve, but they have no symptoms. Stage C is what I was talking about. That's when patients begin to develop their symptoms, and that's also the phase where we go from the term heart failure to congestive heart failure, because the congestive part means the heart is not pumping enough, the kidneys start to hold on to water, and you accumulate water in your system. And then stage D are the last stages of heart failure. So yes, A, B, C, D.
What triggers the body to not, the kidneys, literally to not take water out of the blood?
Okay. When the heart is not pumping, the kidneys will not get as much blood. Okay. And so they get the signal that they need to increase the blood volume. And so they will stop excreting as much urine and retaining more fluid. The fluid then winds up in your lungs, and that's when shortness of breath occurs.
So Steve, nice to see you again. I've known you for a number of years. You've been with this, you became the CEO of this company, Lifewave Biomed. What is the technology exactly? What are they delivering as a solution to what Dr. Kirsch just described? And what phase does it fit?
Well, it's a really interesting technology. The body of work was initially developed at Lawrence Livermore Labs. It was taking the idea of radar, let's say military radar, and miniaturizing it into a very small package and using those principles to determine motion and tissue density. So this is the sensor, and if one holds it up against the body, it sends out repeated pulses of microwave energy, very low level, equivalent, let's say, to Bluetooth. We see all those reflections, and then using various algorithms, we can discern the information we're looking for.
Very good. So when I was doing my research, I saw that there were all these other systems that are invasive. They go into the body, and they register all this information, and then they send it up to some database or in the cloud. But then someone has to analyze that and decide, is this a condition? And as I understand it, your device does one thing and one thing, maybe more than one thing, but one thing very well. It detects this buildup of fluids in the body.
Well, it does two things, actually. Okay. So it is a platform technology. It has a lot of applications within the body. We initially actually looked at maternal fetal monitoring, but it excels at lung interrogation in a way that no other imaging technology does as well. So for example, ultrasound, it doesn't do as well through bone and through air. This sensor will measure the level of fluids on an absolute level, and secondly, assess respiratory function. So respiratory patterns, depth of respiration, looking at identifying patterns. So when you think of lung fluids building up, your respiratory function is going to be affected as well. So this measures both. The average patient in managing this is going to respond better to the information of their respiratory function. But we get both and get the opportunity to play both off each other to diagnose the patient's condition.
Good. So now the big savings, as I understand it, is keeping people from going back to the hospital. Right. Maybe I can ask you to give us an insight to that.
Okay. About 10 years ago, the readmission rate for patients with heart failure, once they came out of the hospital, within 30 days was 25%. That meant 1 in every 4 patients, when they left the hospital, was back within 30 days. And quite honestly, when I read that statistic, I said, wait a second, you mean to tell me 1 in every 4 of my patients is back in 30 days? I didn't realize it, and I can tell you that my colleagues didn't realize it. Now, today, after 10 years of working on this, that readmission rate has gone from 25% down to 22%. That's not that impressive a change. Now, there are many reasons for it, and we're not going to go into all the reasons, but we'll look at what something like this can help us with. Patient goes home from the hospital. Perhaps they've been interrogated with this device before they go home. The doctors are saying, oh, look, there's no more fluid left in the lung, or there's a normal amount of fluid left in the lung. This patient is okay to go home. That's the first good thing. And then they get a device like this to take with them. And they can make those measurements every day, and that can be sent back to us, and we can interrogate that, or we can have the patient figure it out themselves. You know, today we're in an era of what's called PGD, patient-generated data, Fitbits, and all these things. And everybody's got the data at the end of the day of what they did. Well, this is the same thing. Okay. And to get the patient to understand what it means and then take action on it is really where we want to go with this.
So the action they would take is, hey, my fluid is going up, and I need to go in a scheduled way, not an emergency ward or emergency call. And what does the patient do? Does this device send a note to the doctor, or do they?
Well, a few things. So first of all, the one thing I might add is that this is not a wearable per se. So you hold this against your chest maybe 15 seconds a day. So it's a brief assessment. And then basically the data is being uploaded to the smartphone. There will be a very good smartphone application backed up with artificial intelligence that gives the patient a lot of information. You can't expect the patient to be interpreting lung volume, water, extravascular lung water. So one makes it very simple. And then alerts are sent, particularly in the 30-day period following release, to the staff at the hospital to indicate, is the patient taking the drugs? Is their fluids in check? The breathing? A lot of information to help decide how the patient is doing.
Dr. Kirsch, what do you think of this technology?
Well,
I'm putting you on the spot, I know. But
No. I'll tell you what my colleagues think of it.
Okay, that's
all right.
Yep.
When I go to one of my colleagues and I say, "Hey, would you like a little device that's about the size of an oximeter, and you can walk up to a patient, put it on them, look at your smartphone, and it'll tell you if the patient has fluid overload or not, what would you think?" And they'd say, "I want one."
And the patients will want one. So there's several models. The 30-day period is important because the hospitals don't get reimbursed on the first trip to the hospital if the patient comes back. And as Dr. Kirsch said, 22% come back within 30 days. 50% come back within 6 months. So the average heart failure patient is hospitalized once per year. So this will, and the more they're hospitalized, the lower their life expectancy. So that we can have them maintain a better quality of life by helping them manage their own condition with a device like this.
That's one of the points I was wanting to make with you earlier with regard to the treatments that we have for congestive heart failure. We have a whole bunch of different drugs that we can use that will improve the patient. But one of the things that is most telling in terms of prognosis and improvement to the patient is patient education. Educating a patient about their condition so that they understand what's happening to them is a critical part of this whole thing. And so when it comes to self-management, a tool like this in the hands of a patient who's been educated can be something that will prevent hospitalization.
And that helps compliance too. Compliance is always an issue with these out-of-hospital technologies. And if the patient is getting meaningful data that they derive value in managing their condition, they're more likely to use it.
It would seem that everybody, if they had access to the data and a device that gave them feedback, they would go, "This is great, I can self-manage my condition," correct?
Absolutely.
Have attitudes significantly changed in the last 10 years about awareness and self-treatment, self-diagnostics?
I would say definitely yes in terms of awareness and self-diagnostics and the use of telemonitoring at home. One of the things that I did in the last things I did before I retired from clinical practice was to be medical director for telehealth for Sutter. So we were monitoring patients at home and giving them the type of education that they needed for self-management. So that was a very successful program. I would say the people who are hardest to get on board are the doctors themselves.
Oh, really?
Oh, yeah. The hospital administrators aren't. They want it because they know it's going to affect their bottom line. The patients want it because they like what we're doing with them. Getting the doctors to change their habits is a difficult thing, but slowly they are coming around.
Steve, what's coming up for the company next then? You've got the funding you're going to do, the round you're going to raise, you've got the test for the FDA, correct?
Couple of pieces. The next 6 months, we're going to be doing more validation studies. We've got a lot of clinical data, but more validation studies, which are going to be driven in China, and then the institutions I mentioned here at the Cleveland Clinic and Ohio State. From there, we will show that data, share that data to certain large med tech companies with whom we've been speaking that have said if they see that data, they'd have very high interest in investing. So we'll be doing that. And then with that closing, we expect $10 to $12 million, which then sets up the final stages of development and studies for the FDA clearance. We don't see a lot of risk in the process. It's just really execution. And one more thing I would add, the other piece to this whole thing beyond the sensor itself is the artificial intelligence, which is becoming a big part really of every product these days, but notably in medical devices. And I would say, in the past, one could think of this as solely a monitoring device. And that, in and of itself, presents a perception that the physicians have to look at the data. Well, with AI, you can make it more of a therapeutic, which improves care and allows the patient to better self-manage and make it a lot simpler for everybody to work with the data.
Well, thanks so much. That is great information. I really want to thank both of you for coming in. I've really enjoyed the conversation, and I'm sure our audience has learned quite a bit also. Let me ask you if you'd like to provide some information on how people could follow up with the company.
So we do have a website. There's not a lot of information on the website. but it's Lifewave Biomedical or lifewavebiomed.com. That's one way to get there, or to just contact me at sstevenson@lifewavebiomed.com.
Very good. So you're retired now, right?
Yes.
But are you available to be contacted if a doctor wanted to follow up with you?
Yeah, you can find me on LinkedIn, and my contact information is there. But basically, I've been volunteering. I teach students still, and I also volunteer at the Chabot Space Center in Oakland, where I'm learning a whole new field called astronomy.
That's great. That's great. Well, once again, let me thank both of you for coming in. I've been very interested in the topic. You've informed me and educated me, and I wish you every success going forward.
Thank you, Jim.
Thank you.
This is Jim Connor. Thank you for joining us for this week's episode of Game Changer Silicon Valley. Each week, we'll address an area of innovation that may emerge as a game changer of tomorrow. We look forward to your continued interest and participation in upcoming shows.